Standard Chartered Bank to launch a partnership between AMREF Health Africa with its subsidiary AMREF Flying Doctors to cover or to provide evacuation cover for the customers and the staff of Standard Chartered Bank Kenya. The reason for this is, if you were to go back to the way healthcare is done in this country and globally, is that health needs are unexpected. Health needs occur without expectation. So a child may fall, somebody may get a burn, somebody may have an accident, and when they occur, people generally do not have the resources required to take care of themselves. Yet, health is one of those very basic human rights that needs to be provided for generally, so that you have a peace of mind. So in this country, the president has announced universal health coverage. Universal health coverage in this country and generally means that people have access to the health services they need, where they need them, when they need them, without financial difficulty. Now, the only way to do that is actually to pool resources. And this is why around universal health coverage, we talk about social insurance. Pool resources for those who can afford to pay for themselves, and pool premiums so that when they need care, they are taken care of without having to worry about where the money comes from. But on the other side, the government also does provide for people who can't afford, for the poor. And even now, we know that the government does provide, for example, for secondary school students, for air evacuation in this country. So the reason for this partnership is to ensure that those customers of Standard Chartered Bank in Kenya who may have health insurance but do not have emergency health insurance, is that an extension of health services, that actually you do not just need health services, insurance for health services that you access from hospital, because you may need to be evacuated from one place to another as an emergency, and that can also add your out-of-pocket costs, that because the aircraft are important, that they are expensive to moving you when you need that service. So this provides an opportunity for the customers, for staff, to make sure that they have that extra protection, and therefore they have peace of mind. Remember that in this time of COVID also, we've actually seen that the health systems, all the way from where the people are to where they need care, have been stretched. We've seen challenges transporting people to places where they need to be. We've seen overstretched capacity. And we've also seen a lot of calls, not only from Kenya, but from the region, on people who are positive for COVID and they need evacuation. So as AMREF Flying Doctors, the team has prepared to ensure that they can transport COVID positive patients safely by purchasing what we call patient isolation centers that have negative pressure, meaning that even if somebody is positive, they can infect the crew that is actually transporting them. We are probably the only air evacuation company across Africa that has actually invested in that. And this makes it safe for the patients, for our staff, and for the people who are receiving the patients to know that they can take care of the patient without worrying about their own health. Of course, we are really worried about health workers, and therefore that is the reason why we take those measures to make sure all our health workers in the aircraft, in our ambulances, and in the receiving hospital are all taken care of. So we want everyone to join this partnership so that they have peace of mind, and at the same time help the country to move forward in managing the pandemic.
Things that we decided about a year ago when we refreshed our strategy is to make sure that whatever we are launching, it's what clients need. And we did a survey. We talked to a lot of our customers and our clients, and health was on top of mind. That is something they would like us to solve for. And we sought out to say, okay, we are not in the health business, but there's definitely a way we can partner, and we can look for like-minded partners who can help us solve this problem for our clients. And that's how the partnership with AMREF was born. The issue of health is paramount, is important to a lot of our clients, and especially so now. And we've spent time trying to build this partnership. And most important is we wanted to make sure that the connection, even the members signing up, the members paying up, our clients paying up for the membership, which is $2,000 a year for the evacuation, is all done digitally. Because that's where we are putting a lot of our investment. A lot of our investment is on for our retail customers is on mobile phone. That's where most of the banking is being done. So we made sure the integration ensures that if anybody is signing up for this program, they are signing it on up digitally. So it was to make sure that we are solving for the clients and making sure that we are solving for their health needs. So this is evacuation. We have other partnerships as well, whether it's matters of, whether it's on education, whether it's on hospitalization, or even we call them the farewell plan as well. Those are very important, and it's something that we are doing for our clients.